Have you or someone you know has taken a double dose of Wegovy or Mounjaro by accident or even on purpose, thinking it might speed up your weight loss? Well, you're not alone, but it's important to know what really happens when you take too much. So, in this short video, I'm going to explain to you why this happens, what it does to your body, and what to do if it occurs. I'm Dr. Rajesh, consultant endocrinologist and bariatric physician. So I see a lot of people who are troubled with weight and have hormone problems. And they do come to me asking for help, especially when they've taken a double dose. So people may take a double dose, especially when they're really frustrated, when they find that their weight loss is not as expected or the weight is plateauing. So they want a quick weight loss and they, by mistake or even wantingly, take a double dose. But some do take it inadvertently because both Wegovy and Mounjaro are weekly injections. And sometimes when you're very busy, you don't know whether you took this week's Mounjaro or Wegovy and you may have another one. So inadvertently, you could take an extra dose of these medications. And some of my patients have come and said, look, I can't see that it's suppressing my appetite. And that's the reason I've taken another dose. Again, that's very wrong. So, what happens when you take a double dose? These are powerful medications. Wegovy contains Semaglutide, and Mounjaro contains Tirzepatide, and they have their own side effects. The common side effects are nausea, vomiting, diarrhea, constipation, heartburn. These are very common. And then there are serious side effects like pancreatitis, which is very rare. And some people have a very delayed gastric emptying leading to hospitalization. So, what you need to do is you need to look out for these symptoms of severe nausea or vomiting, dehydration, diarrhea, constipation, abdominal pain. And when you have these symptoms, you should seek help. So, how does this medication work? So, let me give you an idea. Semaglutide is what is there in Wegovy, which lasts in the body for 7 days. That is, its half life is 7 days. And Mounjaro's half life is 5 days. This means the drug stays in your system for over a week. So taking extra dose doesn't clear faster. So it will take at least a week to clear off. So the way it works is, as you know, it slows gastric emptying, makes you feel full, reduces your appetite by acting on the appetite center, stimulates insulin production and glucagon, leading to decreased blood sugars, and thereby helps with improvement in blood sugar control and weight loss. So, what to do if you double dose? So, if you took a dose twice or more, the first thing to remember is please stay hydrated. Monitor for nausea, vomiting, or abdominal pain. Do not take your next scheduled dose early. Wait until 7 days after your last dose to take the next one. Don't try to balance it out by skipping multiple weeks unless told by your provider. You've been doing all these things, but when to see a doctor or seek urgent medical attention. You should seek urgent medical attention, see a doctor or go to the emergency department if you have persistent vomiting or inability to keep fluids down. So you're becoming dehydrated, or you got severe abdominal pain, or there's signs of pancreatitis, which is inflammation of the pancreas, wherein you have sharp pain over there just below your chest in the middle, which is radiating to the back. There's fever, vomiting. You may not get all these symptoms, but you have severe abdominal pain. Please don't delay. Always see your doctor immediately. And also, you should see a doctor if there's severe dehydration or confusion. So, but the most important thing is don't panic. If you're taking a double dose, usually it gets out of your system. A lot of my patients say that, look, they had a bit more nausea, there was some diarrhea, and then eventually it settled down. But always keep yourself well hydrated. So the most important things to remember is please do not get these from online prescribers who are not medical people, and make sure that you're always supported by a doctor. when you're injecting, and follow the guidelines. It's very important to follow the guidelines and seek help from your doctor. Hope I have provided an answer, but for more evidence-based guidelines on any topic related to weight management, doesn't have to be about medication, please do let me know. Bye for now.